technology designed to enhance our healthcare could be hiding serious risks. Fog computing is revolutionizing data management in medicine, but beneath its promising facade lie dangers that could jeopardize patient care. As healthcare systems rush to adopt AI-driven data processing, they may overlook critical fog computing warning signs. What happens when the technology we depend on begins to falter? Imagine a hospital making life-or-death decisions in seconds, relying on fog computing. Data delays and security vulnerabilities could mean the difference between saving a life and losing one. It's a chilling reality. While fog computing accelerates data processing, it also introduces unexpected weaknesses. Misconfigured systems and inadequate security measures can lead to catastrophic outcomes. Consider a nurse in an emergency room relying on an AI tool for urgent patient updates. If that tool receives data from a malfunctioning fog computing network, the risks are staggering. A recent report highlighted a single data processing error that crashed an entire hospital's patient management system. Imagine the chaos that followed. You might think they must have safeguards. However, many of these safeguards are reactive, often implemented too late to prevent disaster. Awareness is key. Healthcare providers must cultivate vigilance, continuously monitoring fog computing systems to catch issues before they spiral out of control. Collaborating with its specialists to ensure proper configurations and security is vital. When lives hang in the balance, every second counts. Remember, technology can fail us. The next time fog computing is mentioned, be aware of the hidden risks lurking beneath its surface. The stakes in healthcare are too high to ignore these warnings. What if I told you that your health data might be at risk, hidden within the very technology meant to protect it? Fog computing is on the rise in healthcare, yet many remain unaware of the ticking time bomb it represents. As AI continues to impress, the allure of fog computing can be hard to resist, but many individuals don't recognize the potential dangers lurking beneath the surface. The underestimated risks of using fog computing for AI-driven data processing could drastically alter our understanding of privacy and security. Imagine this: you're in a hospital, and your doctor accesses your medical history through fog computing. Sounds efficient, right? But when that data is processed at the edge, it becomes vulnerable to breaches. Suddenly, your personal information isn't just numbers, it's a target. A recent study revealed that unauthorized access to networks in fog computing environments occurs more frequently than you might think. Yet, healthcare organizations often overlook this risk, rushing to adopt these technologies without fully grasping their implications. Picture a busy emergency room where doctors depend on real-time data to make life-saving decisions. But what if that data gets compromised? The consequences could be dire. Fog computing relies on distributed nodes closer to the data source, which sounds great, but this decentralization can expose vulnerabilities. Hackers can exploit these points, leading to unauthorized access. Are you starting to see the bigger picture? It gets even more concerning. Many organizations lack proper training for staff working with this technology. Imagine a nurse trying to access critical data but accidentally leaving a door wide open for cybercriminals. The trust patients place in healthcare systems could be shattered in an instant. And what about compliance? Regulations are tightening, yet many institutions are stumbling in the dark. They assume they're compliant just because they're using new technology, but often miss crucial details. Overlooking these nuances can lead to hefty fines and legal troubles. So, what's the solution? Awareness and robust security measures. But here's the tricky part: simply implementing the latest software isn't enough. You need a comprehensive strategy that addresses all aspects. Health data is more than just numbers, it's personal. The stakes are high, and ignoring these warning signs could have serious consequences. As we step into a future dominated by fog computing, it's not just about embracing innovation, it's about doing so with caution. Take a closer look at the systems in place because your health data deserves better. Are you ready to demand that? Imagine a world where your health data is processed in real time, yet hidden risks lurk just beneath the surface. What if I told you that the technology designed to make healthcare smarter could also expose it to serious vulnerabilities? As fog computing gains traction, many are excited about its potential benefits, particularly in AI-driven healthcare. However, the risks associated with fog computing are often underestimated and are on the rise. Are you aware of what could happen if we overlook these dangers? Consider this: in a hospital, devices constantly communicate with one another, gathering vital data to enhance patient care. Sounds revolutionary, right? But what if those devices fall prey to cyber threats? The very interconnectedness that boosts efficiency could also jeopardize patient privacy. You might picture a secure, seamless exchange of information, but what happens when that data is intercepted? A hacker could access sensitive health records in seconds, leaving patients vulnerable in ways they never anticipated. This is just a hypothetical scenario, it's happening right now. Imagine being in a hospital room, trusting that your personal information is safe. Yet, while AI algorithms analyze your data on the fog layer, you might not realize that a breach could expose everything from your medical history to your financial details. The stakes are incredibly high, and the consequences could be severe. Now let's discuss another layer of risk: compliance. Fog computing often operates in a gray area, sidestepping regulations meant to protect patient data. Hospitals may think they are compliant because they've checked off certain standards, but they could be leaving significant gaps in their defenses. And what about data integrity? With fog computing, your critical health information may be processed at the edge, but what if the data being used is flawed? This is just a minor issue. It could lead to misdiagnoses and improper treatments. As healthcare increasingly